Having surgery is a major decision and it should be treated as such. With every decision we make in life, there are pros and cons to every action. Even the simple task of driving your car between the Coachella Valley and San Diego puts you at risk for a car accident or other unforeseen problems. As you could imagine, most of us would perform these tasks without thinking twice, as the risks of getting in a car accident is so small. I often use this example when providing an analogy to someone having surgery. Complications can arise, but they are very rare. Before you embark on such operation, it is important for you to understand the possible expectations and outcomes of these surgeries. First of all, it is important to differentiate a complication from an expectation. For example, after a knee replacement, patients will have numbness on the outer side of their incision. This is common and occurs in almost all cases. This is not a complication, but rather an expectation. Another example is that of a knee replacement, which can click when moving side to side. Patients will notice this when getting in or out of a car. This is the metal touching the plastic inside the knee joint. Again, this is an expectation. I'll start by breaking this section into 3 categories. Those that can occur with either a hip or knee replacement, those that are specific to hips, and those that are specific to knees. All right, let's start with infection. This is the one that keeps me up at night. We as orthopedic surgeons have dedicated a tremendous amount of effort to minimize this problem. Infections can occur in one of 2 ways. The first is a superficial infection called cellulitis, where the skin layer can become infected. It becomes strawberry red, exceptionally hot, and tender to the touch. The treatment for this is simply oral antibiotics. We prescribe a 10 to 14 day course of antibiotics, which most often resolves the problem. This is very different than the standard discoloration and warmth that occurs after a hip or knee replacement. However, they can be difficult to differentiate, and for that reason, we treat them with oral antibiotics when unclear. The second is a prosthetic joint infection. By this, I mean an infection has gone down into the prosthesis or implant. This one is a big deal. It is difficult to fix and usually requires repeat operations. However, this is exceptionally rare. It may occur in patients with increased risks, such as poorly controlled diabetes, obesity, poor circulation, or immunocompromised patients, especially those on steroids or those who take medications that affect the immune system, such as autoimmune conditions or cancer patients. As I suggested before, these can be difficult to eradicate, especially if the bacteria has formed what we call a biofilm around the implant, where it can seek shelter and protect itself from antibiotic treatment. For that reason, reoperation is necessary, and in rare cases, the implant has to be removed. Once surgical intervention has taken place, it is followed with IV antibiotic treatment with close monitoring of blood work. If you have specific concerns about this, please make sure you discuss it with your surgeon. Let's talk about blood clots. These form in patients that are immobile or have had surgery. Obviously, if you've had a hip or knee replacement, you are at risk of developing a blood clot, especially if you have various medical conditions that make you more prone to doing so. For that reason, we often prescribe a blood thinner after surgery to decrease the risk of blood clots. These can form in the lower leg, also called a DVT or deep venous thrombosis, and in very rare cases can migrate from the leg to the lung, also known as a pulmonary embolism or PE. We often recommend some sort of a blood thinner after surgery to decrease this risk. It can be as simple as baby aspirin for low-risk patients or a stronger blood thinner like Eliquis for higher-risk patients. Patients who already take these medications prior to surgery usually stop them before and will resume them after. Injury to a nerve or an artery are exceptionally uncommon during these surgeries. We take exceptional care to protect these structures during the operation. Despite their incredibly rare occurrences, these complications can happen. Around the hip or the knee are 2 major nerves that control the leg: the sciatic nerve in the back of the leg and the femoral nerve in the front. We know their exact location and take every precaution to protect them during the operation. Nonetheless, pressure on the nerve can cause it to malfunction. If it occurs, it can cause a neuropraxia or an irritation of the nerve that will resolve after a prolonged recovery. Like nerves, arteries and veins traverse the hip and the knee. The same applies to these structures. We know their exact location and know exactly how to protect them during the operation. With that said, in incredibly rare circumstances, these too can be injured. Implant loosening is also an uncommon problem that may occur early or late after a joint replacement. If it occurs, oftentimes it can be diagnosed by proper physical examination or imaging. To resolve this, your surgeon may need to remove the existing implant and replace it with a new one. Finally, prolonged joint pain. As with any operation, the intent is to make that joint function better, whether it's your hip or your knee. The long-term goals are to decrease pain and improve function. In rare circumstances, patients report continued pain long-term. It is important to identify why the pain remains and its source. A thorough workup must be performed to rule out things like infection, implant loosening, and other conditions. Patients can also develop acute onset of pain around the hip or knee after surgery. It is important to understand that during the replacement, metal parts are placed at the end of the bones, which create new articulating surfaces. However, the ligaments, tendons, muscles, bursa, and other soft tissues remain in place, and so any of these structures can become inflamed, as they can in a non-replaced joint. If this arises, visit your orthopedic surgeon to discuss a proper diagnosis and proper treatment options. Okay, let's talk about potential problems that occur mostly for hip replacement patients. Dislocations are a concern for patients undergoing hip replacement surgery. This is identified as a scenario where the ball pops out of the socket. You see, in your own hip, it is exceptionally difficult to dislocate the ball from the socket. In a replaced hip, it is not so difficult at all. A lot of this has to do with the integrity of the muscles around the hip joint and the final position of the components. Today, we perform these surgeries with robotic assistance and can optimize the position of the cup and stem to decrease the risk of dislocation. Despite optimal positioning and good patient education, hip dislocations can still occur. When they do, they can be exquisitely painful and require an ambulance to transfer the patient to the emergency room. There, an emergency room doctor relocates the hip. Patients who have recurrent dislocations may need further surgery to try to stabilize the hip. Leg length related problems can also occur. These are more common with hips than they are with knees, but can certainly be noticed with both. When we perform a hip replacement, the primary goal of the surgery is to perform a well-balanced and stable hip replacement. The secondary goal is to provide stability and decrease risk of dislocation. And the third objective is to provide appropriate leg length. As such, the primary goal of the orthopedic surgeon performing a hip replacement is to provide one that is stable and least likely to dislocate. As I mentioned before, dislocations can be identified during surgery, and in rare cases, we will lengthen the operative side just a couple of millimeters in order to optimize stability. With robotic surgery, the incidence of leg length discrepancies has significantly decreased. When they do occur, they are exceptionally subtle and usually do not affect the patient's function. In rare cases, a shoe lift may be ordered to correct the discrepancy noted by the patient. Specific to knee replacements are a few expected outcomes and potential complications. As I stated before, expected outcomes are things like numbness on the lateral side of the knee, a small area that is purely sensory loss and does not affect the function of the leg. Also, clicking can sometimes be perceived in the knee with sideways movement. Another common problem is difficulty with kneeling. While patients are allowed to kneel on their replaced knee, they often report an uncomfortable sensation while doing so. The goal after a knee replacement is a painless knee with a full range of motion. You should be able to extend fully and bend all the way. With proper physical therapy and appropriate use of self-guided physical therapy, patients usually obtain this without difficulty. However, in a certain subset of patients who are prone to developing stiffness in their knee replacement, this could arise in the early phases of recovery, but in some patients may persist long-term. It's also called arthrofibrosis or stiffness of the knee, which can become painful as the scar tissue limits the patient's range of motion. This can happen from a multitude of reasons, including the patient's own propensity to lay down excessive scar tissue or due to lack of physical therapy. Another potential complication is that devastating complication of patellar tendon injuries. Thankfully, this is exceptionally rare, but when it happens, it can significantly alter the function of the leg. The patellar tendon is that structure that attaches to the front of the lower leg by way of the kneecap and helps the leg to straighten while walking. If disrupted, this very thin, small structure can be very difficult to repair. Thankfully, this is a very unlikely complication. Another set of important structures around the knee are ligaments. These are medial and lateral collateral ligaments that stabilize the side-to-side movement of the knee. Again, injury to these structures are also incredibly unlikely and only occur in incredibly rare situations. Understanding these potential complications and expected outcomes will help you make informed decisions about surgery. If you have specific concerns, please discuss them with your provider.